As we cover your health tonight, it's Salt Awareness Week. Now, salt is unquestionably the most common and essential seasoning in the world. But News 15's medical editor, Dr. John Lepre, he explains that too much of it can have a negative impact on your health.
This is Salt Awareness Week, and we eat way too much of it. Salt is a big risk factor for high blood pressure. This in turn is a big risk factor for heart disease and stroke. Each day, we average 3,400 milligrams, almost 70% more than the recommended amount. That's 2,300 milligrams, or about 1 teaspoon per day. We know that a salt-restricted diet will lower the systolic blood pressure 8 points and do it in as little as 7 days. That's better than some blood pressure medication, and it even works in those without hypertension. Now, contrary to what you might think, the majority of our dietary sodium, or 71%, comes from prepackaged foods in restaurants. Only 11% comes from home cooking or added at the table. The rest is naturally occurring. Food doesn't have to taste salty to be high in sodium. Let's look at the top 10 list. Were you surprised to see bread and pizza top the list? Salty snacks like chips, popcorn, and pretzels don't appear until number 7. Finally, labeling can be really tricky, so let's decode things. Sodium-free does not mean 0. It means less than 5 milligrams per serving. Low sodium means less than 140 milligrams per serving. Reduced sodium means 25% less than the regular product, which can still be quite high. And no salt added simply means no salt added during processing, which can also be quite high. And finally, check those serving sizes. A package can have multiple servings, in this case reporting 1/6 the total amount. Remember, the biggest source of salt comes from prepackaged foods in restaurants, so keep that list in mind and limit that salt intake. Wishing you better health, Dr. John Lepre, News 15.